Hi there. We are here today with Dr. Timothy Spiker of the Positional Release Therapy Institute. How is the Positional Release Therapy Institute treatment approach different from traditional medicine?
I think that's our number one seller because it's so different. And it's different and effective at the same time because, we know a lot of alternative therapies out there aren't very effective. So while they're different, it's pain-free. It doesn't hurt while it's done. There's no cracking. There's no forcing tissues. We're essentially invoking a reflex that as the therapist feels under their fingers and they manipulate it. It's called the fasciculatory response. They're manipulating it to essentially cause the neurologic system here at the brainstem, at the brain, and also your spinal cord to send a message back to the tissue, and it lets it go. It releases it. And it happens within 5 seconds to a minute. So most patients are completely pain-free within about 5 seconds to a minute with like a specific structure. Let's say you got a knot here, right? We can make that pain go away within 5 seconds because what we're essentially doing is we're manipulating the neurologic system in a passive, pain-free way and capitalizing on the way the neurologic system works, and we're helping facilitate that. And so that's a huge difference because there's no drugs involved. There's no putting a needle through the skin to poke it and introduce infection or hit a nerve. There's no kind of cracking you and hoping for the best, sort of thing. And even if you do mobilize, which is very appropriate to do at times, you don't want tissues and bones kind of hung on each other and fighting each other when you try to move them. You want them to be able to move gently. And so by releasing those tissues that are binding around those bones and those vessels and so forth, blood returns, moves, it moves, the bones move, things just kind of restore themselves. Your body has this homeopathic, sort of osteopathic ability to return itself to a healing state. But times we get stuck, we get tied up and need to be released and allow things to kind of reset themselves. So that's a huge way the PRT works. And I think versus the traditional model, and not to mention, it can be done anywhere. Like I've treated patients in the airport, treated patients on the field, in the workplace, at home, my daughter at the soccer field. So that's what's nice is because all you need is your hands and the ability to do it. And then you can do it anywhere, almost on any patient of any age, even patients with osteoporosis, because there's no force. Instead of forcing the tissue, we're actually moving away and allowing it to release and reset itself. It's a neural reset.